Welcome back to Learning Anatomy with Dr. Bakare. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the greater sciatic notch versus the lesser sciatic notch. We would be looking at how these two notches are transformed into foramina. Also, would be highlighting the different structures that are seen to pass through these two foramina. So let's look through how the greater and the lesser sciatic notches are transformed into the greater and the lesser sciatic foramina. If you look at this image, this is the configuration of the bony pelvis, and this region is the posterior view of the bony pelvis. We know that the pelvis is structurally made up of three subcomponents. So if a demarcation is created along this part that is highlighted here in dotted black, we see that on one side of the bony pelvis, at this superior end, we have the ilium. And if you go more inferiorly at the posterior region here, we have the ischium, and we have the pubic at the anterior region. So these are the three structural subunits of the bony pelvis. And as you have this presentation on this side, you also have it on the other side. Specifically, if you drive through the ilium, at this region that is demarcated here, you see that there's an indentation that is created at this space. And this indentation that is created at this region is referred to as the greater sciatic notch. So this greater sciatic notch is a notch that is created around the ilium. So if you go more inferiorly at this still posterior end where you have the ischium, you also have another indentation that is created around the region of the ischium. And this is what is also demarcated here at this region. And this is what is referred to as the lesser sciatic notch. So you see that we have at the posterior region of the bony pelvis, we have the greater sciatic notch around the ilium, and we have the lesser sciatic notch around the ischium. We already established when we started this lecture that the pubic is located at the anterior region. So these two notches, the greater and the lesser sciatic notch, are seen at the posterior region of the bony pelvis. The subunits that are located around this region are the ilium and also the ischium. And this is where we have these two notches created. These two notches are further transformed into foramina by ligaments. So let's drive through this to establish how they are being transformed into foramina. So if you look at the inferior end of the greater sciatic notch, you have the sacrospinous ligament. This is the sacrospinous ligament here highlighted at this region. And as I've always said on this channel, all we need to do is to always break down the name. Sacrospinous ligament is a ligament that is seen to run from the spine of the ischium to the sacrum. And this is how the name is being drafted. So if you look at the sacrospinous ligament at this region, is where we have the spine of the ischium. The spine of the ischium is like a sharp protrusion that is seen around the ischium. So you see it running from this end and of course directed onto the sacrum. And this is where you see that it is inserted on the sacrum. So you have the sacrospinous ligament, then transforming the greater sciatic notch, which is an indentation that is created on the ilium, into the greater sciatic foramen. So this is how the greater sciatic notch is transformed into the greater sciatic foramen by the sacrospinous ligament. And this is what is created here around this point. And this is what is seen to be highlighted here in dotted blue. This kind of presentation that is seen at this upper region is also exhibited at this lower region, where we have the lesser sciatic notch. So this is where we say we have the lesser sciatic notch here that is harrowed here in yellow. This lesser sciatic notch is also transformed into the lesser sciatic foramen by another ligament. And the ligament in question here is the sacrotuberous ligament. And this is what is seen to be highlighted here in yellow. As we have illustrated with the sacrospinous ligament, we're also going to be illustrating with the sacrotuberous ligament. We know all we need to do is to always break down the name. So sacrotuberous ligament means a ligament that is seen to connect the tuberosity of the ischium to the sacrum. And this is where we say the name is being drafted from. So if you look deep through the sacrotuberous ligament at this region that is harrowed here in yellow is where we have the tuberosity of the ischium. So you see the fibers running from this end and are being directed onto the sacrum on this other end. So this is where you now have the sacrotuberous ligament transforming the lesser sciatic notch, which is an indentation that is created on the ischium, into the lesser sciatic foramen. And this is what is saying to be carved out here also in dotted blue. So you see how these two notches, the greater sciatic notch and the lesser sciatic notch, are being transformed into the greater and the lesser sciatic foramina. And these foramina are so created because of these two ligaments, the sacrospinous ligament and also the sacrotuberous ligament. And we've tried to illustrate how this transformation occurs using this illustration. So if you try to drive further in establishing the structures that are seen to also pass through this foramina, we say that the notches are transformed into foramina, and these foramina are not created for fun, but are created to allow for the passage of structures. So we would be driving further to highlight the different structures that are seen to pass through the greater and the lesser sciatic foramina. So if you try to use the second half of this bone in pelvis at this other end here is where we have the greater sciatic foramen. We already established how the greater sciatic foramen is created, of course, as a transformation of the greater sciatic notch by the sacrospinous ligament. So this greater sciatic foramen, you see that it is further subdivided by a muscle. We have a muscle that is referred to as the piriformis. Let's say the piriformis is highlighted here in blue. The piriformis is known to take its origin from the anterolateral surface of the sacrum, and you see that the fibers are directed through the greater sciatic foramen. And this is how this muscle is seen to exit the pelvic cavity, because their insertion point is outside the pelvic cavity, and this is where they will finally be inserted on the greater truncata of the femur that is located, of course, around the lower limb region. So you see that the part of the piriformis, they are seen to further subdivide the greater sciatic foramen into two subforamina. So if you drive deep, you see that at this upper region, we have the suprapiriform foramen, and at this lower region here, we have the infrapiriform foramen. So you see that the greater sciatic foramen is seen to be further subdivided into two foramina. And this is as a result of the path through which the piriformis muscle runs through this foramen. So you see that you have a foramen created at the superior part of the piriformis, and you have another foramen, of course, created at the inferior part of the piriformis. And this foramen that is created at the superior part of the piriformis is referred to as the suprapiriform foramen, while the foramen that is created or seen at the inferior part of the piriformis is referred to as the infrapiriform foramen. So it's good for us to understand the basis onto which this formation occurs. So now that we know that the greater sciatic foramen is further subdivided into two foramina, we are going to be highlighting the different structures that are seen to pass through the supra and the infrapiriform foramina. For the suprapiriform foramen, we already know that this foramen is seen to be located above the piriformis, because the piriformis is the basis onto which the greater sciatic foramen is subdivided into these two subforamina. So the suprapiriform foramen, we have the superior gluteal artery and the superior gluteal vein. We know that the superior gluteal artery is a branch from the posterior trunk of the internal iliac artery. If you go back to our lecture on the internal iliac artery, we already established or highlighted this artery. We say that it emerges from the posterior trunk of the internal iliac artery. So as it emerges within the pelvic cavity, it is seen to exit the pelvic cavity because it will be supplying the gluteal region. And it is through this foramen that it exits the pelvic cavity. So you see the superior gluteal artery and the superior gluteal vein passing specifically through the suprapiriform foramen, even though we know that it is going to be exiting the pelvic cavity through the greater sciatic foramen. Because we know that the greater sciatic foramen is now further subdivided into two foramina. So specifically, it will be passing through the suprapiriform foramen, which of course is a subset or subunit of the greater sciatic foramen. Another vessel that is seen to pass through the suprapiriform foramen is the superior gluteal nerve. The superior gluteal nerve is one of the branches from the sacral plexus. It is also seen to pass specifically through the suprapiriform foramen. So these are the structures that are seen to pass through the suprapiriform foramen. For the infrapiriform foramen, we have the inferior gluteal artery and the inferior gluteal vein. The inferior gluteal artery is a branch from the anterior trunk of the internal iliac artery. We also established this artery in our previous lecture on the internal iliac artery. So you see that the inferior gluteal artery is seen to run specifically through the infrapiriform foramen. Of course, we know that the infrapiriform foramen is a subset of the greater sciatic foramen. The next vessel that is seen to run through the infrapiriform foramen is the internal pudendal artery. The internal pudendal artery is one of the terminal branches of the anterior trunk of the internal iliac artery. It is also seen to specifically pass through the infrapiriform foramen. We also have the inferior gluteal nerve. The inferior gluteal nerve is one of the branches from the sacral plexus, and it is seen to pass through also the infrapiriform foramen. We also have the pudendal nerve. The pudendal nerve is one of the branches also of the sacral plexus, and it is also seen to pass through the infrapiriform foramen. We also have the sciatic nerve. The sciatic nerve is a nerve that is seen to supply the lower limb region, but it's also seen to pass through specifically the infrapiriform foramen so as to exit the pelvic cavity to access the regions where it will be innervating. Then we have the posterior femoral cutaneous nerve. This nerve is also an emergence from the sacral plexus. And as it emerges, it's also seen to specifically pass through the infrapiriform foramen. Then finally, you have the nerve to the quadratus femoris. The nerve to the quadratus femoris is also a branch from the sacral plexus. And this nerve is also seen to pass through the infrapiriform foramen. So you see that you have a number of vessels and also nerves passing through the infrapiriform foramen. And the essence of this is for them to exit the pelvic cavity, supplying the gluteal region or the lower limb, as the case may be. So these are the list of structures that are seen to pass through the greater sciatic foramen. And we've tried to highlight specifically the structures that are seen to pass through the supra, also the infrapiriform foramen. Then going to the inferior region where we have the lesser sciatic notch, of course, also transformed into the lesser sciatic foramen. And this is what is carved out here in dotted black. And this lesser sciatic foramen that is created at this lower region is also seen to allow for the passage of some structures. So the structure that is seen to pass through the lesser sciatic foramen first is the obliterator internus. So you have fibers of the obliterator internus muscle passing through the lesser sciatic foramen. This obliterator internus muscle are seen to emerge from the posterior border, posterior wall of the obliterator foramen. And from this region, the fibers are directed through the lesser sciatic foramen so as to exit the pelvic cavity. And this is where they'll finally be inserted on the greater truncator of the femur. So in this course, the obliterator internus muscle is seen to pass through the lesser sciatic foramen. We also have the pudendal nerve. Then we also have the internal pudendal artery and veins. So these structures are also seen to pass through the lesser sciatic foramen. Remember, these vessels are elected as one of those structures passing through the greater sciatic foramen. The pudendal nerve and the internal pudendal artery are seen to exit the pelvic cavity through the greater sciatic foramen, and specifically they exit the pelvic cavity through the infrapiriform foramen. And upon the exit of these vessels, they are seen to also re-enter back into the perineum. And as they re-enter back, they are seen to pass through the lesser sciatic foramen. And this is why you have these vessels also highlighted as one of the structures passing through the lesser sciatic foramen. So you have the pudendal nerve and also have the internal pudendal artery and also vein, also passing through the lesser sciatic foramen because they need to access the perineum. And in quest of this, they are needed to pass through the lesser sciatic foramen so that they would be able to access the perineum, where they will be supplying the structures that are located within this region. So thanks for watching this video. Let's continue to stay glued to this channel.